Now with a report on treatments for stroke. Here's our reporter Laura Windsor.
Over 750,000 strokes are suffered by Americans each year. Knowing what the warning signs are can save your life, and many treatments can be given to reduce and even eliminate the effects of a stroke. Doctors David Brown and Michael Brant Zawadzki of Hoag Memorial Hospital Presbyterian in Newport Beach discussed their stroke unit and the immediate interventions administered to patients experiencing a stroke.
A stroke is a sudden onset of a focal neurological deficit. That can be manifested in many ways. That can be a sudden onset of weakness in one side of the face, typically, weakness in one side of the body, the arm, the leg, numbness, typically, again, involving face, arm, and leg, typically on one side, although it can be both. Sudden onset of difficulty speaking or understanding what's said to you, sudden onset of difficulty walking or with your balance or with coordination, and sudden onset of the worst headache of your life. So those are all signs of an acute stroke, and if you were to experiencing those things, you need to call 911 to get to the hospital immediately. There are about 750,000 strokes in the U.S. every year, which makes it the third leading cause of death in the United States, second leading cause of death worldwide. But it's actually the most important thing is that it's the most common cause of long-term disability. And of course we can really impact that if patients get to the hospital quickly so we can give them the newest, most innovative treatments for that stroke. There's some therapies we can only give within the first few hours of stroke. There's one thing called IV TPA, which is tissue plasminogen activator, and we can only give that out to about 3 hours. Whereas we have other newer approaches where they actually take a catheter and bring it up to the area of obstruction and can either pull out the clot or dissolve it using medications, and that can be done out to 8 hours. And with the ability to treat advanced neurological diseases with neurosurgery, invasive types of monitoring if that's appropriate. We have something called the Arctic Sun, which we can actually cool patients to achieve normothermia or normal temperatures in the context of having a fever and neurological disease. So these are some of the ways that we're working with the ICU to provide good care.
Well, comprehensive stroke centers really are integrators of multiple disciplines and multiple affiliated healthcare workers, all targeted on the patient's problem. The standardized process includes not just the work in the emergency room, but a reaching out to the laboratory, the X-ray imaging staff, to be ready to accept the patient for their piece of the process, which is critical in formulating the next step, which is the appropriate treatment. The Penumbra device is the newest FDA-approved device for acute stroke treatment. Think of it as a tiny little vacuum cleaner that we snake up into the area where the dirt has clogged up, if you will, the clot has clogged up the artery, and disimpacting the clot with a little stirrer device while the vacuum is on, allowing the vacuum to suck up the clot and reopen the vessel. And so the Penumbra device is used to prevent a stroke, one that has started in its process to being a stroke but may not yet have developed, and the whole idea is to keep it from developing. So the whole idea now is to get the patient into the hospital as quickly as possible, because it's the earliest hours that are critical for preserving brain tissue, and administer the modern therapies to save as much of the brain tissue as possible, rehabilitate the patient, and return them to a functional life.
Make sure you know the warning signs for a stroke and get emergency help immediately. It can save a life, maybe even your own. I'm Laura Windsor for the American Health Journal.
And now